Good afternoon. Welcome, everyone. Thank you for joining us for the Technology Learning Collaborative webinar on COVID-19 and vaccine access. My name is Kate Rivera. I'm an independent consultant. I support TLC as well as some other organizations. Just wanted to start by briefly sharing with you a little bit about the Technology Learning Collaborative, or TLC. So we are Philadelphia's first professional development organization dedicated to digital literacy providers and advocates. Our mission is to drive the digital literacy, access, and inclusion conversation in Philadelphia by promoting professional collaboration, training, and networking among organizations and institutions that have a dedicated interest in moving these areas forward. You can go to our website, which is tlcphilly.org, to learn more. You can also, if you're not already on our email list, join our email list there. And so today's topic is the digital divide and COVID-19 vaccine access. And we have a few folks who will be presenting today. First will be Terry Clark from Philadelphia's Department of Public Health, who's going to share the latest information and resources with us. And then we'll hear from a couple organizations, just a little bit about some of the strategies that they've used to help get their clients and community members connected. So after Terry speaks, we'll hear from Toby Dichter, the CEO of Generations Online, and Gretchen Schanfeld, Senior Director of Program Operations and Strategic Growth at Nationality Service Center. And then at the end, we'll have some time for all of you to ask questions. And also, we'd really like to hear your ideas and strategies for what you've been working on or thinking about working on in this area. And so with that, I'd like to turn things over to Terry Clark. I'm going to stop sharing the slide. Terry, welcome.
Hello, nice to be here with everybody. I am going to share my screen let's see, advanced sharing options. Is that what I want? Do I want to do just share my screen? Nope, here we go. I got it. And this is what we're going to do to share. Okay, and everybody can see it, right?
Yep.
Okay, and I want to do my slide share. Let me get rid of this. How can I move this down here a little bit? It's not letting me move my nuts. Hang on, bear with me. Can you still see that on your screen?
Yeah, I think once you hit the slideshow, it should.
Yeah, I'm trying to get to slideshow, but I can't move the. There we go. Okay, now I got it. I'm trying to get rid of the top bar where it says mute and stop video, right? And so I can press slideshow. Let me see. Hang on. Let me try this. Let me just try to click this and drag it down. Nope, that's not going to work. Oh, bear with me, everybody. Why is that there?
If you want to try in the bottom right of the screen, there's little, I don't know what it is, like a little stand with a projector on it. Slider.
Let's see. It says notes. That's
that. Keep going over to the right.
Okay.
Not there.
Yep. To the right. Okay. Now I got to get rid of my little gallery view. Let me get rid of all those pictures.
That's all right. If you just go all the way over, click on that
slideshow.
Yeah.
There's not.
There you go.
What a team. It takes a village. It really does. Okay. So we're off to the races. Here we go. We're going to talk about vaccine information. I am Terry Clark. I'm with the Philadelphia Department of Health. I'm an outreach specialist in the COVID containment division. My aim today is just to give you an overview of COVID, talk about vaccines, sort of where we are in the big picture, share some latest updates, and then looking forward to hearing from the community partners who are helping us bridge the digital divide in terms of vaccine access. So just real quick, we all know this by now, but COVID-19 disease is a disease that is spread by airborne particles. And, we know the symptoms, right? Coughing, shortness of breath, difficulty breathing, fever, chills, muscle and body aches, the classic loss of taste or smell. And, even though there's been a lot of emphasis now, around vaccine distribution, vaccine equity, I will say that testing is still important. We are seeing in particular zip codes in Philadelphia that the COVID numbers are, COVID cases are rising. And that is in large part due to folks not having the vaccine. So testing is still an important message. The health department has many testing sites across Philadelphia. So when we talk about, right, the digital divide around COVID, we need to be able to talk about vaccine access, but then also access to testing, sort of go hand in hand. And then isolation and quarantine in those kinds of support. So, okay. So, but I'm going to focus today's messaging around the vaccine. So we know that the vaccines are safe and effective, that they were held at the same safety standards as all vaccines, which are very strict. They were done in large clinical trials and included diverse populations, older adults, people with underlying medical conditions. They included pregnant women. And the FDA's emergency use authorization is really just a process that helps facilitate the use of medicines and vaccines during public health emergencies, such as our current pandemic. So, if we're part of our work is to dispel myths and provide, factual information, a lot of what people's hesitancy is around some of these myths about the vaccines being developed at warp speed and how could they possibly be safe. But we know that, the trusted sources, the CDC, the World Health Organization, they're very high safety standards. And, what happened right behind the scenes here is that the researchers used existing networks to conduct the vaccine trials. So they weren't recruiting from the get-go. They were using folks that were already in those vaccine trials as people as part of their clinical research. And the manufacturing began when the clinical trials were underway. So it was a parallel process. And normally manufacturing doesn't start until after the completion of trials. And here too, the technology had been previously developed, right? So people had been working on, right, the COVID virus is part of the SARS family of virus, and researchers have been working on these viruses for many, many, many years. And then the FDA and the CDC really just prioritized the review and the authorization of these vaccines due to the pandemic and the public health emergency. And what we know about mRNA vaccines, that they are faster to produce than the traditional vaccines. So there's 3 available. I'm going to mention briefly, maybe some of you have heard that the pause for Johnson & Johnson has now been lifted. So the health department is now using Johnson & Johnson in some of our clinics. So that is a 1 dose. It's what we call a viral vector vaccine, which is just a little different mechanism of how the vaccine works on the immune system. As I said, it's 1 dose. The Pfizer and Moderna vaccines are mRNA, so their technology works just a little differently in the body. Both are 2 doses. Pfizer is 21 days apart. Moderna is 28 days apart. Pfizer is approved for 16 years and older, Moderna for 18, right? So here are some of these myths, right? That the vaccines do not contain COVID virus. They're not going to give a person COVID-19. The vaccines don't change DNA in any way, and they will not cause a person to test positive on viral tests. right? So basically what happens is that in the immune system, right, this is the vaccines use a small strip of genetic codes called mRNA, and it teaches your body, it teaches your immune system how to make that spike protein that's found on the COVID-19 virus. And then once your immune system recognizes that, the antibodies go into action and they begin to fight off the COVID-19 infection, right? So that's how vaccines work. That's how the mRNA vaccine works. The viral vector vaccine works in a very similar way, but it just uses a modified or weakened harmless virus to teach our immune system to make the spike protein that's going to trigger the immune response, the antibodies, and then that fights the infection. Okay. The COVID-19 vaccines were very, very effective. They were actually more effective than the flu virus or the flu vaccine, right? Up to 95% effective, highly effective against severe, highly effective to prevent against hospitalization, right? So, we've got folks that get mild COVID symptoms and recover fairly quickly. We've got folks that have more moderate symptoms. Their recovery takes a little bit longer. And then we got folks who get COVID and they end up in the hospital on the respirator. And then we know some people have died from COVID, right? So it affects us all differently. And what we know from the vaccine, though, is that people who've gotten the vaccine will really prevent hospitalizations and death, and will minimize the impact that if you are exposed to COVID, that you will get very sick and have severe symptoms. So what to expect after COVID-19 vaccine? A lot of this is already out there in the press and folks are talking about it, right? There is some side effects. Most people have fever, injection site pain, headache, muscle pains, tiredness, fatigue, right? That's just signs that your body is building protection. And when we talk about being fully protected, that means 2 weeks after your last vaccine. So if you've gotten the Johnson & Johnson vaccine, that's 2 weeks after your shot. And then Moderna or Pfizer, it's 2 weeks after that second dose that you're fully protected. There is an app. I know this is not necessarily helpful for folks who are having, digital divide concerns, but there is an app called VSafe that you can sign up to get text messages from the CDC that will just check in on you and how you're doing since your vaccine and how are your symptoms, how are your side effects. And it's just a way that they gather data around some of the safety, concerns or issues folks may have with the vaccine. So the eligibility for COVID-19 vaccine, right? Anyone now in Philadelphia, everyone is eligible who's 16 years or older. And people who have had COVID, it's still suggested that they get the vaccine, right? People who should not receive the COVID-19 vaccine are people who have a severe, like anaphylaxis reaction to a vaccine or a vaccine component, people who are younger than 16 years of age, people who currently have COVID-19. It's recommended that they clear the COVID-19 virus before getting the vaccine. And anybody who's received another vaccination, maybe that was shingles or the flu shot within the last 2 weeks. Okay. We don't know. Here's another question that a lot of folks are asking. Are we going to need a booster shot, right? We don't know how long protection from vaccines will last because we haven't even been using them for a year. So this is research that's ongoing. We're continuously collecting data. And this is all, it's all part of the learning of living with COVID. Okay. Folks ask, what is the best vaccine for me, right? The best vaccine is the first one. It's available to you. Now fast forward over the last several weeks, our vaccine accessibility has just exploded. There is so much availability for vaccines all across Philadelphia that it's becoming much more easier to access. Now we're beginning to see more of the issue of hesitancy, right? So how can we work with our communities to help people provide correct information and help them move along a continuum where maybe they are unsure or they're feeling less confident in the vaccine. There's no charge for the COVID-19 vaccine, right? Insurance is not required. You don't need identification. I mean, people may ask for your ID, but that's really just to complete the registration information that's taken at vaccine sites. You may be asked for like a proof of a residency in Philadelphia. And at this time, it's not mandatory to be vaccinated. It's an interesting subject that there's some debate around mandatory vaccines. Sometimes in other countries, there are mandated vaccines. Do I still need to use precautions, right? So actually the CDC just released today, I'm telling you, information is coming out the pipeline daily, just released new guidance for people who've been vaccinated versus people who have not been vaccinated in mask wearing in indoor settings and outdoor settings. But generally speaking, the CDC is still recommending that if you've been vaccinated, you continue to wear a mask and keep your social distance. The difference is when you're with other fully vaccinated people. So you can be indoors without wearing masks, visit with unvaccinated people from a single household who are at low risk for COVID. If you're fully vaccinated, you can refrain from quarantine and testing following a known exposure if you are asymptomatic. So, there have been breakthrough cases of folks who have gotten vaccinated. I'm vaccinated, I'm fully vaccinated. If I came in contact with somebody who had COVID and I started to develop symptoms, I would need to quarantine, I would need to get tested and sort of follow that, that path. If I, as a fully vaccinated person, came in contact with somebody who had COVID and did not develop symptoms, then I would just continue on and not have to take any different kind of action. There are travel restrictions across the world. There are countries that are being ravaged by COVID. And so both domestic and international travel, I would just recommend that folks check the CDC for the latest information because that is changing with travel restrictions. Okay, so in Philadelphia, we're, like I said, currently vaccinating all adults over the years of 16 years of age. If you are under 18, you need a parental or a guardian consent. Data is available, lots of data is available at phila.gov/COVID. If you would like to look, I'm not going to dive into all the numbers in this, but it's published by lots of different demographic breakdowns, and it's available on a daily basis with updates daily. So what are we doing here in Philadelphia? We've administered over 1 million doses. We have agency-hosted vaccination clinics that are operated by lots of contracted partner organizations. You know that lots of pharmacies are available to deliver the vaccine. Doctors' offices, primary care providers are now delivering the vaccine. FQHCs and outpatient clinics have the vaccine. The fire department is doing some great work with the homebound population. PDPH mass vaccine clinics are operating both at Esperanza and at the Philadelphia Convention Center. And we are continually looking for community partners who would like to provide vaccines. So the Black Doctors Consortium is one of those community providers. And there is, if folks are interested in doing that, there's a request for proposals on our website. So transportation, oftentimes that can be a barrier for folks. And Office of Emergency Management and SEPTA have really worked hard, and the health department have really worked hard to break down the barriers around transportation. So there's the detail here. I won't talk through all these points here, but there are transit passes available for round trip fare. There is door-to-door service, so folks can call 311 and schedule, if they have a vaccine appointment, they can schedule a CCT expanded service to bring them door-to-door to a vaccine clinic and then back home again. There are community shuttle services. So if there's an organization that was coordinating a group of people, there could be a shuttle that could bring folks to the vaccine site and then back to their community center. So what are we doing in terms of equity? Right, we're really putting the vaccine in FQHCs across the city and the pharmacy chains that are located, throughout the low-income neighborhoods in Philadelphia, and are staffed and utilized by, their community members. We're partnering with the Black Doctors COVID Consortium and really using the social vulnerability index, looking at those neighborhoods with low vaccine rates and really doing a targeted effort out there. We've got a new hotline established that I'm going to talk about in a minute, and we've started to do in-person registration sites. So bringing our laptops and our staff to the community to sign people up for the vaccine. This is just a picture of some of the different vaccine sites that are located across Philadelphia. And then walk-ins have been really made much more widely available. So people don't need an appointment. They can do walk-ins. You can schedule 311. And this new hotline, the PACE COVID Center hotline, which is a collaboration between PCA, Philadelphia Corporation for Aging, and the Department of Aging's PACE program. And this is this hotline just opened the other day, 800-424-4351, to help get access to an appointment or information about where I can walk in, or other COVID related, testing related questions that folks may have. And then we have our PDPH COVID containment call center at 215-685-5488. And then 311 has also been doing a lot of work in terms of the call centers. Okay. The Center City vaccine site flyer with information about that, and Esperanza at 4th and Bristol, which is kind of 5th and Huntington area. And then we are still using for this time the vaccine interest form if folks want to fill that out, but we're really going to be phasing away from that. And then just to wrap up, just kind of talking for a few minutes about vaccine hesitancy, right? So how can we support people making the decision to get the vaccine? And I think this is going to be a lot of the work that we're going to be doing in the coming weeks, that we want to convey that the risk of severe illness and death from getting COVID-19 far outweighs any benefits of natural immunity, because people will just say, well, I'll just wait till natural immunity and then I don't need the vaccine. But that's not really, it's misleading, right? And that, folks can go to their healthcare provider or their trusted leader in their community. Maybe it's their faith leader or their spiritual person to get information about the COVID-19 vaccine, and really encouraging folks to get the information that they can make the best decision for them. There's the PA Unites Against COVID has some information on how to talk to friends and family about COVID-19 vaccines. And really, these points are to listen with empathy, ask open-ended questions. Here's another one, write the COVID vaccine conversation guide, hashtag this is our shot, right? So we really want to help people, motivate them, right? So we talk about motivational interviewing, and instead of trying to force other people to change, we can help them just understand their own intrinsic motivation to change, right? And asking open-ended questions, listening carefully. How would you stop the pandemic? Or tell me more about your reasons not to get vaccinated. Or can you see any benefits to getting vaccinated? And have conversations along those lines, right? So starting from a place of empathy and understanding, kind of, I go into it assuming folks will want to be vaccinated, but they have questions, right? Giving strong recommendations, whether that's from Dr. Fauci. And I heard the other day somebody was talking, oh yeah, I got my Fauci ouchie, right? So sometimes using humor, or just using like, this is our one shot, let's do it, or take your jab, Philly, kind of, I don't know, just kind of making it easy to access and have conversations around it, right? Sharing key facts, which I've shared with you today, responding and listening to questions, and proactively talking about the side effects and common myths. Right. This is just a video clip from AARP. I'm not going to show it to you, but I stick it in the
Oh, did we lose Terry?
It looks like she might have frozen up.
I thought it was me, so I was waiting for myself to unfreeze. Let's talk about the digital divide.
Well, we wait for Terry to unfreeze her. Maybe folks, if you have questions, you can put them in the chat.
Yeah.
Looks like we lost her completely.
Yeah.
There she is.
So now you're on, Terry.
Was I on mute that whole time?
No. Now you're at no. You're right.
Oh, thank God. Okay. Oh my word. That would have been terrible. Anyway. But we're good, right?
I think we lost you for a second. You were on the slide, but there was a video.
Oh, okay. I didn't show the video. Okay, let me just go back there.
That's okay. Yeah. If you just want to.
Okay. Yeah, I didn't show. Let me just see here. I am.
Yeah, you don't need to show the video. I just didn't know if there was more that you
Okay. Yeah, I think you can still see the slide now, right? The newsletter?
No, we lost your screen share,
Oh,
actually.
you lost the screen share. Okay. Well, you know what? For the sake of time, let's just move on. I was pretty much at the end anyway. So I think we can just transition to the next piece. That's fine, Kate. No problem.
Great. Okay. Well, thank you so much, Terry. That was a really great overview, a good background for this discussion. We will do some Q&A shortly, but first I wanted to give Toby and Gretchen each a chance to briefly share. So they're each going to talk for about 5 to 10 minutes, some of the strategies that they've been using to help folks get connected, and then we'll move to questions and other ideas and comments that other folks have. So Toby, if you'd like to start your presentation.
Hi, everyone. It's nice to be back to TLC. Before we get into the van that Terry has so wonderfully provided for older people, if you think about what you need to know technologically to get the vaccination, you need to know how to access a website. You need to know how to have an email address. You need to know how to open a text. You need to know how to search. You need to know how to type. And you need to have some trust and to feel as though I understand the difference between a scam and a secure site. And that's the business we're all in, right? So what Generations Online has been doing for the past 2 decades is simply trying to deconstruct so much of this only for older people, because most of the rest of us, you are on, but 25% of people 65 and over are not online. So I'm going to just take you through the 2 things we've done in the vaccine effort, but it's underpinned by our generic work in digital literacy for older people. And I can provide any URLs or any background or anything like that offline or in the chat. But basically, I think we're looking for partners who want to be part of the deployment of these. Okay. The first thing I'm going to show you, I'll share my screen too once I get up my slide presentation, is something Terry inspired. Bless your heart, you're everywhere. And let me share my screen. And wait 1 second. I want to what we found was that this is a pain in the neck, Terry, you know it. I'm on the wrong slide. Hold on. Oh dear. Let me talk to you first. Share, and then I'm going to go to, guys, take me through, because I'm having the same problem that Terry had, which is to get just to the slideshow.
The
If you go
bottom
down-
right.
Yep.
Oh, yeah. Next to the slider. Yep, it says slideshows. Click on that.
Can you see the zoom on the bottom right there?
Yep.
Yeah, that symbol to the left of it is this, it starts your presentation. It's right next to the minus sign on the Zoom.
I was clicking, I thought. No matter what, you can see it from this. We're all experienced. The first thing I want to is, oh, for God's sake. I apologize. I just, this is the basic. Can you see this? Can
Yeah.
you see that?
Yeah,
We're good.
yeah.
Those are the 4 things we normally teach in, here we go. This is good. In, oh, I'm actually online now. Can you see this?
Yep. We see we're on your 6th slide of the presentation.
Oh, you do?
Yep. This is before you start.
This is the technology group, right? This is we are all techies, and I am so embarrassed. I can't tell you.
This is why we're all here.
Yeah, but it shouldn't be like this. It is not. That's not what's showing on my. I'm going to stop sharing, and I'm going to share again. But what I wanted to tell you was, and I don't even have to show it to you because I don't want to take up any more time. What we tried to do was deconstruct the vaccine interest form, and the interest form had government form filling out. And the fact that you and I and all the screen jockeys are so used to being able to fill out a form, drop down boxes, typing, radio dials, this is not intuitive to an older person. And an older person who is already a little skeptical of government, perhaps. So what we created was a tutorial. It's free. Anybody can use it. We have shared it with the mayor, with the Secretary of Aging. The mayor's office then approached us and asked us to help with a call center. So you've got older adults working from the Mayor's Commission on Aging. And that call center staff, 25 people who've been given a script, who've been asked to log on. And I'm just sharing with you sort of privately, they cannot get through the login. They cannot get through scrolling to the bottom of the screen and then entering the person's data. it's really disheartening. And so the mayor's office came to us, as they had in the census, and Generations Online provided a tutorial. And I have to say, I mean, it's like 150 pages to get them through 3 pages, because you've got to have one for Android, you've got to have one for iOS, you've got to have one for phones, you've got to have one for tablets, you've got to have one for PCs. And each one of these versions is something that, depending on what the person's doing. To my great surprise, these same people who are calling out about vaccines are being asked, they have to enter the data on the same device that they're talking to the person with. So you had to teach them tabbing. So any of you who want us to be the first door to entry, that's fine. I think the fact that people didn't know how to sign up for the census, that they didn't know how to sign up for the vaccinations, is going to link more and more older adults into the technological. Even those with their arms crossed say, I don't want it, I don't need it, I've lived 70 years without it. They too are going to jump online. So if any of you want to see it, I'll put in the chat the URL for the one for the vaccine interest, and for our easy tablet help for seniors, the website. We also have apps. And I'd be happy to take any questions afterwards. And I do apologize for wasting your time with my PowerPoint.
Well, no problem, Toby. Thank you for sharing that. And then Gretchen, if you could share with us a little bit about what Nationality Service Center has been doing.
Sure, and I don't have slides, and now I'm thinking that's a blessing that I don't have slides. It was great to hear what you all are working on, so thank you. Nationality Service Center, we're a multi-service agency serving immigrants and refugees, and so our challenge is not only digital literacy and the digital divide, but also language barriers. For more than 80% of our clients are non-English speakers, and only a few speak kind of other primary languages like Spanish, where a lot of information is readily available. We have a lot of folks who speak Karen or Swahili or very minority languages that may be hard to find information in. And so we also face a community that is very tech savvy in terms of phone, but not so much in terms of navigating websites and online registrations. And so knowing those challenges, we've actually developed some workarounds to technology, and are trying to use some really targeted technology, I would call it, to really reach into communities. And I'll talk about that a bit as well. One of the first challenges that we realized was just the challenge, not necessarily with completing the vaccine interest form, because if you've seen that vaccine interest form from the city, it's pretty straightforward. It was initially only available in about 5 languages and has been expanded, and it's pretty straightforward. But then when folks were getting the "it's your turn," there was a lot of navigation on the back end of select an appointment and enter this information. And folks were really getting lost in that system and calling us, calling their case manager or their attorney or a staff member and saying, "Can you help me?" And what we were finding is that it was challenging to help folks when they had kind of already started that process and needed access to their email and things of that nature. So what we did is actually dedicate a hotline, a multilingual hotline within our agency where folks could call. They can get question and answer about vaccine access, and then we could directly register them for an appointment. And that throughout the previous several months that we've been working on vaccine rollout has really been helpful for people to have a primary resource to actually get them scheduled. Now we're really excited that 311 is able to directly schedule appointments. So it's kind of a hotline for everyone. And we are directing our clients back to that resource. But we found particularly in the early days, that when people were calling or accessing, they really were motivated and wanted to access vaccine. And so being able to provide that quick connection was really important. We also found that text and text messaging was a really preferable method for a lot of clients. They would, through many of the clinics, they would both email and text clients their confirmation or appointment confirmation. And clients would often say, yep, I got my text. It was a very comfortable mechanism for people to kind of know that they had an appointment and where they were going. As we move into the next phases, I think, we're working with different populations who may be experiencing more of that hesitancy. And so we're kind of ramping up a few different things technology-based. Throughout the pandemic, we have used a voice messaging software that leaves voicemails in a client's preferred language about key information. Everything from the new rental assistance application is opening up, or vaccines are now available, information about safety of vaccines or why you should take vaccine. And that's been a really accessible method because it doesn't require it allows us to do mass communication, but it doesn't require folks to have an email to be able to read a text in any language. We send out a voicemail targeted within their languages. We have about 12 languages that we were able to put the messages in, which is our primary language. So there's a lot of great tools. We're using something called Parent Reach for that, which is actually designed for school-based outreach, but we're using it primarily for outreach to our client population. We're also really seeing the impact of more targeted messaging software. So for example, the Syrian community, which is probably around 200 to 250 families, a pretty small community, Arabic speaking here in Philadelphia. They have a WhatsApp group, it has a whole bunch of members, and being able to tap into those types of existing networks is going to be really important. So can we send out our Arabic hotline flyer, very simple, to that network, and having a trusted member of that group that message for us. Also looking at Facebook and other social media. So, can we promote things on our Facebook, our client-facing Facebook, our Instagram page, really kind of making sure that we're getting multiple modalities out there. And then we also recognize there are folks who are not going to engage perhaps with any technology in order to uptake vaccine, and just recognizing who those folks are and where we might need to do some more proactive outreach. So our staff has done a lot of calling, and in future kind of subsequent phases, we intend to do kind of direct community by community outreach. The health department in Philly is really doing some amazing work by census track, even block by block, so we can really see, where we need to focus our efforts. And we're, really thinking that we can, by leveraging these kind of various modalities, we can really make an impact with particular sectors that may be a little more hesitant, or maybe just haven't gotten the right information yet.
Great, thank you so much, Gretchen. And now we want to open the floor up to all of you. If you have questions for any of the three speakers, you can put them in the chat or use the raise hand feature if you'd rather speak verbally. And also beyond questions, if you have ideas that you'd like to share or strategies that you've been using that you found to be effective that you'd like to share, we very much welcome those as well. There was one question in the chat earlier. I think it was to Terry, but anyone can jump in and answer. The question is, has there been work done around engaging the community to understand the nuance of hesitancy in different communities?
Yeah, I can chime in on that. I know that there was a survey done for the LGBTQ community around vaccine hesitancy. I believe the results will be forthcoming very shortly. The survey was done back a few months ago. So there's that piece, but yes, I mean, some folks are hesitant because of their own medical conditions. Some folks' hesitancy lies within the social injustices that have existed, you know, throughout history, and the institutionalization of racism and, you know, just all of that. Some folks' hesitancy lies within just not having heard from a trusted community leader. You know, the other day I heard, it was on Spotify, I was working out at the gym. I know I feel so guilty for saying I work out at the gym, but everybody wears masks. I wear masks, everybody's social distance. I need it for my mental health. Anyway, I was listening to Spotify at the gym, and I hear Michelle and Barack Obama messaging about the importance of, you know, the COVID vaccine. So I'm thinking to myself, wow, there are people who wanted to hear that message from Barack and Michelle, and that would be enough to tip their, you know, the scales in favor of them, their hesitancy. But yes, you know, point well made that people's hesitancy, and another word that's being used is to reframe it in a more positive way, is just around building vaccine confidence. And so people are at all different stages of readiness, right? We're talking about behavior change, right? The readiness to get a vaccine, and where that hesitancy lies is in all different places. So hence the importance of asking the open-ended question, right? What's holding you back, or how can I help you feel more confident about the vaccine? And will all require different approaches. So thank you for that question.
I can just add briefly, if anyone is working with immigrant, refugee, newcomer populations, there's a really great resource out of the University of Minnesota that is really compiling everything from community assessment toolkits that use, as you said, very open-ended questions. What are the biggest concerns you're seeing in your community? So it's not even so personal. It's kind of asking people like, what are your neighbors saying? Trying to get the lay of the land that way. They're also doing a really great job compiling translated resources, because there's a lot that's out there, and bringing them all into one resource library. I think there's over 5,500 resources in like 120 languages on that site. I put it in the chat.
Thank you. Are there any other questions that folks have or ideas? I'm curious just to hear like how, you know, it seems like almost overnight we went from it's impossible to get an appointment to I've seen people on social media saying, you know, there are walk-ups at the convention center and there's no line. You know, so I'm interested to hear how that experience has changed the strategies that you're using to get folks connected. And I would also ask, like, you know, I've seen people on Twitter or on Facebook saying, hey, there's no line at the convention center right now, right? But if you're not on Facebook or Twitter, you might not know that. And especially if you have mobility issues, you don't want to go to the, you know, go there and be waiting in line in the rain for 3 hours, right? So ways to, you know, get people connected to the walk-ups in a way that they're comfortable with too. Anyone has any thoughts on that?
Yeah, I mean, a lot of that vaccine supply was just, you know, a bottleneck from just months of different administration, let's just put it that way, right? And just trying to figure out how we're going to roll this out. And I gotta say that it may not always look like this front facing of the community, but there were discussions about how do we do this equitably. That we knew, I mean, we knew what happened, you know, links got shared and, you know, lots of white people who lived in high-rise condominiums in Center City were getting vaccinated, you know, all that happened. But there were conversations, and there still are, about the equitable distribution, and that equitable distribution also includes people with the digital divide. And I think that, you know, part of a lesson that can be learned from COVID, and I think there's a lot of stuff there to unpack, but one of them is that in Philadelphia, we have a digital divide, and people knew that before the pandemic, and now they really know it. And hopefully resources like y'all are working on, and the Mayor's Office of Innovation and Technology and other providers will, you know, get people access to the Wi-Fi, get the digital literacy happening, get the access to the hardware that people need. Yeah, so I just think that, you know, there was all that happening, and that was part of the reason why vaccines were not so widely available, right? There's a few different things going on, but now that they are, we're seeing those people who want to get a vaccine are able to get one, right? Maybe a little transportation glitch, but we can work through that stuff. It's going to be the bulk of folks who are, you know, on the fence, that are unsure, that we need to work with and meet where they're at with, you know, helping them get that information. So.
Thank you. Yeah, I'm curious if anyone here has held or is considered holding maybe like workshops or more informal discussions with clients and community members, you know, about the vaccine, and starting to address some of those hesitancy or confidence building moments.
I think it's hard when we're all meeting online.
Mm-hmm.
You're working with low digital literacy people. You can't say, here's a Zoom link, join us. Like, they're not going to come. But there has been a lot of educating on the community leader end. And I think with communities that, you know, may be a little further along in terms of digital literacy. And I think a lot of those have been very successful. I know I had a staff member about 2 weeks ago who was involved in kind of a vaccine information, I think I would call it, event for the Ukrainian community, primarily in Northeast and Lower Bucks County, where they had physicians from the community explaining. It was all completely in language. And I think things like that are really successful, even if they kind of give the resources to the folks who may be already on board, that they can then share with their friends and neighbors and family. I think that can be helpful.
Absolutely, thank you. I guess last call, if there are any questions, comments, ideas. It's been a quiet group this afternoon.
I'll come on in just to say a comment, you know, how this ties into a lot of different things that we've experienced during the pandemic, that we've had to deal with. Similar to this is kindergarten registration. That's one thing we're dealing with a lot right now too. That is all online right now, requires you to upload multiple documents, things like that. So I know some of our programs are assisting people with that online as much as possible. But there's a lot of different things like this and throughout people's lives that we take for granted that we do online, that, you know, anywhere from new parents to, you know, seniors that they're struggling with. So that's one reason why we're having these workshops as well, is just to kind of create awareness for these things too. So thank you, you know, to Toby, Terry, and Gretchen for sharing this information. It was wonderful to have you here today.
Yeah, thank you as well. Here's the question. If some libraries are doing mutual aid fairs, and I wonder if there's someone we could contact to come out and help people register for vaccines and answer questions. It sounds like Terry. Oh, you're on mute, Terry.
Okay. Yes, I see that. Stephanie, thank you. Yes, absolutely. You know, I will put my information in the chat because I know it and it's readily available. And then I will connect you to probably a better person to do that. But I'm doing, let me do that right now. And please follow up because we definitely have folks that can do that work. Absolutely. And in anyone else, you know, if you need that support from the health department, please reach out to me and I'm happy to connect you to the best people to support the work that you're doing. Yeah, and we do a lot of work trying to debunk the myths, getting people jazzed up, ready for their vaccine, all that stuff. So I'm going to put my information in there now. So thank you.
Great. Thank you, Terry. Yeah, thank you for doing this webinar. I know you've been doing a lot of these talks and partnering with a lot of groups. So, so thank you for the work that you're doing. So I do also want to just mention, in case you did, for not checking the chat, everyone, that Toby and Gretchen also shared some links to information in the chat. There's some good information there. Terry just put her contact information in. And I put a link to a quick feedback form. If you could just take a couple minutes, it shouldn't be long. Most of the questions are optional, just to give us a little bit of feedback on today's webinar. We do webinars on different topics related to technology every month on the fourth Tuesday of the month at 2 o'clock. So the next one will be on May 25th. And we use the information from those feedback forms to come up with topics for webinars and improve what we're doing. So please do just take a couple minutes to fill that out. That would be really helpful. And that's it. So thank you so much, everyone, for coming. Thank you for the work that you do, and enjoy the rest of your evening.
Thanks, Kate.
Day.
Everybody, thank you.
Thank you.
Take care.